welcome to Reality Check. I'm your host, Lou Meyer, and this week returning is my good friend Don Williams. Dr. Williams, thanks for coming on.
Thank you, Lou, for inviting me again.
This is wonderful. So what are we going to talk about today?
We're going to talk about a program I'm going to be doing on September 12th called Clearing the Nervous System of Trauma. And we're going to go into depth on why people don't heal. You know, why do some people have an injury and it becomes a chronic issue, and other people have an injury and it heals just fine and they go on?
So, all right, this is good. So you mean so I have an ankle that I twisted when I was in my 20s, and now when it rains, it still hurts. Not all the time, but it'll hurt. And if I wear the wrong shoes, is that kind of some of the stuff we're talking about?
Exactly what we're talking about. The body is built to heal itself. It knows how to heal. It was designed to do that. If it's not doing its job, something is interfering with the process.
Wow.
And that's my specialty, is identifying what is interfering in the process, removing that interference, and then coaching my patients on what to do to keep themselves from doing that again.
Well, let's start off by, I guess I just described what trauma is, but that's a physical trauma. What other types of trauma can you help work on?
Well, trauma, we think of a trauma as an injury, a concussive force, something that leaves a wound. So that wound can be a physical issue, it can be an emotional issue, and it can be a chemical issue, because we know that we can be exposed to chemicals that affect our health and our bodies, just like we can have emotional stresses and physical stresses. So when we look at traumas, I usually like to look at that there are short-term, high-intensity stresses and long-term, low-intensity stresses. And the body is more designed to deal with high-intensity, short-term stresses. When you trigger a fight or flight response, when there is a threat, a physical threat, it's usually a short bit of time. If you're being chased by a tiger, you know, it's going to last 10, 15 seconds. It may feel like 10 or 15 hours.
Yeah, sure.
But it's going to be resolved. You know, either you're going to get away or you're going to get at. You know, one or the other. It's, you know, all the chemicals that are produced in that response are used up in the moment. What is the hardest thing for the body to deal with, because it wasn't designed this way, are these low-intensity, long-duration stresses that are triggering these physiological responses, triggering these chemicals like adrenaline and cortisol and all these other things that settle in the tissues and keep you out of a healing response.
What do you think? This is interesting you bring this up. So recently I've been reading in the paper, well, not recently, but for quite a while now, that the air quality is really bad based on nonsense coming up from China at this point. They just found some. But a lot of the younger kids that I know, my son's friends, are developing asthma-type symptoms. Is this kind of a similar thing we're talking about, over time chemical trauma?
Sure. We're talking about stresses that over time cause these physical symptoms. And of course, what our traditional way of doing is we treat the symptoms.
Right. Oh, and the Western medicine way of attacking stuff.
And even some of the alternatives. We'll use herbs or vitamins or some other treatment for that condition, but not get to the causes. Because we could say that the poor air is causing irritation in the lungs, but so much of the time those children are already stressed, either because of diet or emotions or using their bodies improperly, so they can't adapt to that additional stress of the poor air, and they become, of course, asthmatic.
Is this like an immune system thing? Or
exactly.
It is.
Because the immune system is suppressed in an emergency response. And again, we said it was supposed to design to be for a short period of time. But if you prolong it, and you prolong the immune system being suppressed, you're going to have some dire consequences.
It's just so, all right, well then what would you do? How would you help these people?
Well, one of the things, first I would do a full evaluation of how their nervous system is running. Always remembering from our previous talks that the role of the nervous system is to control and coordinate every function in the human body. It's the communication system. Every single cell, every tissue, every organ, every gland, everything that goes on needs to have that communication. It needs to be in full communication with itself. So one of the things that happens is that there is energetic breakdowns that are expressed physiologically. So I have some very simple saliva pH testing, which we talked about before, checking blood pressure in several positions to see how they're adapting to stress. And I have some very high-tech computerized scanning equipment that measures thermal differences and electrical activity in the muscles. So I take a thorough evaluation to see what's going on, and then we start to go through our procedure to identify the interference, which you and I talked about, that we may sometime do another show, do an actual demonstration of how this is done, because you know it's kind of hard to describe, but we do identify, the main thing is we do identify the negative emotions that are stuck and how that's affecting the body.
And so when you have a traumatic situation occur, that stops that whatever the flow of energy that's happening in your nervous system somehow.
Somehow, exactly. Because what happens is let's say that two people have been in a similar accident. Let's say they're rear-ended at 10 miles an hour. One person, 2 months go by, they're fine, they're healed, no complications. Another one, 2 years later, they're still experiencing pain. They're starting to experience degeneration of their spine now and degeneration of other tissues because the excessive stress really causes premature aging.
Wow. So there's some sort of psychological part of the equation that's contributing to this, I guess you would call it a chronic condition now.
Exactly. What happens is that the nervous system, the subconscious mind, because that's really what runs your body. You don't have to think to run your body.
Right, right.
We've talked about this before. And so what happens is if there is an emotional stress around the time of a physical trauma, they get locked together. And then the subconscious mind is distracted by trying to heal the emotional wound, which it wasn't designed to do, and it distracts it from the job it was designed to do, which is running your physical body and be able to help you survive in a physical world. So what happens is that other person that 2 years later, they might have just been fired from their job before the accident, a death in the family, a relationship problem, down the line that happened sometime around the time or previous to the trauma, and it gets locked in. So we have to identify what that issue was, free up the energy that's being dedicated to and stuck trying to heal this emotional issue, and free it up to heal the body.
Well, so it sounds like an impossible task. Like saying, something happened to somebody 20 years ago, and now they're still, suffering this chronic physical thing. But you can get them back to the point of remembering what happened before the trauma.
Exactly. Exactly.
That's amazing.
It is an amazing procedure. Dr. Morter, M.T. Morter Jr., who developed the technique, really was just keying into something so great because, there are many tools out there, as you and I were talking about learning how to think more positively and learning how to vision and manifest. Yet what do you do with all the thoughts that are stored in memory before you learned how to do that? Those are the things that's hanging you up because you create from a subconscious. You create your life from your subconscious.
Well, how does this differ from like psychiatry or psychology or that sort of thing?
Because what's happening with the psychiatry or psychology, they're only talking about what their person is conscious of. For instance, you might be aware of feeling angry. So now you go to anger management classes, which are fine.
But they're only teaching you how to manage the anger. They're
and
not
not
telling
get
you
to
how
the
to
cause.
get rid of the anger, get to the
cause might have been a bushwhacking around happiness when you were very young. Now you become angry because you can't have the happiness you want consciously. So they're always working with anger, but until you go through the doorway of the wound that's around happiness, the subconscious doesn't get updated.
How do you know? I mean, do you have to have some sort of a physical thing? I mean, obviously people would be coming to you with some sort of physical ailment because that's what you're doing. But then do you help them kind of find other things that they may not even know about? Or?
Exactly, because they don't know about these things. That's the key, is this procedure allows us to find out what is hanging them up, what is stuck in the subconscious, and continue to repeat. Because the subconscious mind does not think, evaluate, or judge, or reason. It purely responds. It responds to the stimulus in the moment. And that moment, because the subconscious doesn't know time, can be from this moment all the way back to who knows when.
Whenever. Yes. And so can you retrain, well, since the subconscious is only taking input, can you retrain that with some new, thought process? You go, well, and I don't know, I don't want to get off in a big, long rap on my part because I don't know what I'm asking you, but you know what I mean. It's like, can you go ahead in and reprogram yourself or something like NLP kind of thing?
It's exactly what we do in our procedure, is helping that nervous system, helping that subconscious to be reprogrammed and repatterned. Because what happens in life is that most people go through life purely just unconsciously running through their patterns and responding and reacting to life according to pattern. They're asleep. Until you're willing to break a pattern and wake up and make conscious choices in your life, you just keep repeating those patterns. So that's one of the things that contributes to, again, the nervous system just keep doing the same thing over and over and over and over and over, no matter how many times you consciously want something different.
This sounds a lot like some success training stuff I remember reading when I was in corporate life, where the getting to yes process, or changing the way you look at something in order to be able to move forward or do things.
It's very much the same. The principles all very similar. Again, what Dr. Morter created was a system of updating the nervous system so that you can express present time, not bound totally by the patterns of your past experiences.
So, well, once someone, how many treatments would it take for somebody to?
It really varies, Lou. You know, sometimes people come in with physical problems. I also work with a lot of people that are just trying to reach their peak potential. So I'll work with a person initially. They may come in because they have a chronic problem.
That's great.
But then they may want to say, gee, I want to work on evaluating my old belief systems. I want to evaluate why I'm not able to achieve my goals. I want to be as healthy as I can, because that's a big part of what I do too, is a coach. I'm not a doctor in the traditional sense. I'm not going to fix anyone. In fact, if someone comes in thinking I'm going to fix them and they're not going to take any responsibility for their health, I don't keep them as a patient.
Show them the door.
You know, I cannot fix anyone. What I can do, again, is be a good detective and a coach to help them make better choices in what we call those 6 essentials for life, which you eat, drink, breathe, exercise, rest, and think, which is the most important part.
The most important one.